Mr. Pan, thank you so much. Dr. Pan, thank you so much for your work. I very much value your tenacity. I admire your bringing your expertise to this institution, and I really admire your relentlessness in wanting to advance what you feel is important. I really do value that. I think that's why we're all here for. I was very proud to be a co-author on your first bill. I very much value what that did. I think it addressed a lot of issues. When I asked LAUSD to produce the numbers, it's at a 1 to at least 2, if not higher than 2% increase in every segment of the 6 subsections of LAUSD. Average of LAUSD, I believe, is somewhere around 91%. Most of the places are anywhere from 94% to about 93% or 92%. Unfortunately, the one section, which is the west side of LAUSD, is at 87%, and that's why it's weighing down the average. Otherwise, 277 worked. It increased everywhere. It increased the outcomes of immunization everywhere. And when I'm looking at what we're trying to accomplish now, because we've spent about 5.5 hours maybe now, or 5 hours. 4 o'clock, we started at...
Who's counting?
Oh, who is? I'm trying to just figure out exactly what it is we're trying to accomplish, and I appreciate the conversation we had last week as well. Some of the questions I had didn't get resolved. My goal was if you're gonna move forward with this, and I would have joined you as a co-author again, why not look at the physicians that are specifically conducting in a way that we want to hold accountable? If there are physicians that we are aware of who are offering these exemptions without even seeing their patient, why aren't we addressing that directly? Instead of creating this process that we haven't really talked about how much it's even going to cost the state. And I bring this up because most of my colleagues here, especially those of us who have been serving here now in our 4th term, we've been working in health-related issues. We'll constantly work on areas that we're trying to improve health outcomes, and only to have Department of Health, Public Health, come in maybe 6, 7, 8 months into the bill's life after we've done a lot of work and say there's a big cost associated with this. And turning the bill, and then the author has to turn the bill into a 2-year bill, work through the various amendments, work through the various issues until we get it to a place that we can move forward again. But yet, in this case, when we're looking at, when we talk about percentages, so in 2016, we were at about 0.17%, 937 students in 2015-16 school year. And it's gone up to 0.7%, around 4,100 students in 17-18. We're talking about 4,100 students roughly. Out of a population of 40 million in the state, we're talking about a 1/10 of a 100th of a percentage point. So that's why I was also asking when Ms. Burke, right around now, that red wine sounds very good, by the way. When Ms. Burke was asking about the numbers again, I wanted to clarify because 179 cases in 3 years. I feel like it's incumbent on us to want to do a study and ask the Department of Public Health to figure out what are the reasons why we don't have, what are the non-vaccination numbers attributable to, so that we come up with best practices so that we can better address what the needs are. And I don't want to go on and on, Mr. Chair, but I have several other questions. So I'm happy to have a back and forth, and I have some questions for the opposition as well. So whenever you feel happy to allow the author to respond.
Okay, so all right, so I heard you made a lot of statements. I will let me address those. I'm not sure exactly what the question you wanted answered, but first of all, I would point out that.
Would you like me to repeat, just so you know?
No. Well, no. I think if you want to just. Let me just go see if I answer your question,
sure.
All right? And first of all, I would just point out, first of all, the denominator is not the entire population of the state of California. What we're doing is we're talking about each entering kindergarten class. And a child who has a medical exemption is probably unlikely to get vaccinated, and if they have a genuine medical exemption, shouldn't be vaccinated the following year. They have a permanent medical exemption.
I'm sorry, but I got to stop you right there, because when you're pointing out to the examples of the outbreaks, those include many adults.
So okay, let me get to that. So first of all, so what happens is 277 was doing its job, right? Even though it's only been in place for 3 years now. But what we also note is that after 277, we got the immunization rate for overall across the state above 95% for the first 2 years. It's now actually unfortunately slipped below that. But more importantly is that we have schools with medical exemption rates of 10%, over 100 schools over 10%. So the question is, and it's not the school district rate, it's the school, right? In fact, that's the trigger. It's actually the school, it's not the school district. So you mentioned there's some schools in particular parts of LAUSD that have lowered that. That's what would trigger. It's not the overall school district. I would also point out that, you're right. So what happens is that most of the this year's are in young adults, actually. Sometimes we call that the Wakefield generation. Those are the kids who, those are the people who, the reason they're now young adults is they didn't get vaccinated when they were children, right? Because that's when Andrew Wakefield came out with this study that basically falsely claimed that vaccines cause autism, frightened many parents from getting their vaccinated. But, well, unfortunately, we're not beyond that, because those children are the unvaccinated children that have been getting the measles in California. And we also saw this, by the way, in England as well. So you're right. No, a lot of the cases are in young adults in terms of this particular year, in terms of if we look at what the measles cases are. What we don't want to do is we don't want to go add to the group of people who are unvaccinated, right? So again, as you remember, as a co-author of SB277, it's really addressing it year by year. So when we look at it, when we say what's the vaccination rate, it's really only the vaccination rate for the kindergarten class of that year. All right, it's not the vaccination rate for all the subsequent, all the years ahead of them. You have to look at when they were kindergartners to get an idea about roughly where they are. You're right. One of the things that it's not all just about medical exemptions, right? So one of the things that we definitely, public health has done is work with schools to be sure kids who had conditional ones that they were following up to be sure they got the remainder of their vaccinations, right? We need to be sure children have access to health care. Right, and so that's why we have the Vaccine for Children Fund, and we've actually expanded access to Medi-Cal for children who live in our communities, because that way they can get their vaccines. It's not an economic barrier to get the vaccinations. But we also note that the exemption rate has quadrupled, and I would point out that actually if you add permanent, so by the way, if you add permanent and temporary medical exemptions, you're actually above 1.1%. And so the challenge is this. If we do nothing and it keeps going up at the current rate, we are going to be back in the same problem we had before 277. I mean, we could, and so we see the trend line. The trend line each year is continuing to increase. So, but please.
But that's exactly the point. So why not first figure out why the trend is going back up again? Because first of all,
we know why. The Department of Public Health has looked at it.
No, because we don't exactly know how many of the individuals who were going for personal belief exemptions may have not wanted to get a medical exemption. So, we don't, there's a lot of questions we still don't know. So instead of jumping to a legislative fix.
Well, I would refer you to actually research done by Dr. Omar Sayed, who's looked at these data. There's been numerous papers published about what happened in California after 277, because after all, we are the first state to have rolled back the non-medical exemptions. So researchers have been very interested in seeing what has happened. And the thing they made note of, the biggest problem that's happened after 277 is the rise in medical exemptions. That's why there was that study that was published in Pediatrics. They talked to county health officers who made note that that was a big problem. By the way, not every person is actually referred to the medical board for a complaint. We've heard from school nurses. People have looked at, so what happened to the conditionals? What happened? There was actually just a paper published recently in Pediatrics. They looked at all the different potential categories. They call it substitution effect, right? So who had personal belief exemptions before? What was that rate? Now 277, that's driven that down essentially to 0. So what's happening now? And basically they said it's being replaced by, slowly over time by medical exemptions, as medical exemption rates have been increasing. So the research is being done. There are published papers that have looked at this and identified this is the problem. I didn't do this bill right after we did 277, right? We passed 277. We have 3 years of data now. And the reason I'm doing this bill now is we have a large measles outbreak, and the research has come out on what's happened post 277 and what's going on. Are we losing the goals that we tried to achieve with 277, and the research is saying yes, because of medical exemptions.
I'm glad you said that, because the data is actually showing that we're improving. Immunization has actually gone up. Now, if you're going to look at certain subsections, well, that's why I was referring to the LAUSD numbers. When I'm looking and seeing that almost every subsection in the entire school district has improved by either 2%, 1%, or maybe a little bit above 2%. Again, everywhere in the district is above 90%. The only place is the west side, which also improved by a point, but it's still below 90%, and it's significantly below the herd immunity level. I understand that, and I want to help in addressing that. But I don't know if this necessarily addresses it when it goes after such a small segment, as opposed to trying to figure out how is it that we can go after, try to figure out whether through education or through other incentives among the non-compliant students and parents who are keeping their kids non-compliant. So I think we have just such a bigger mark that we can be going after, rather than look at this narrow area. That's why I was started by asking, what is it exactly that we're after? Because if we want to discipline doctors, the bill doesn't necessarily do that.
I would beg to differ, especially given the amendments taken with the Assembly Health Committee Chair.
Please educate me, because from what I understand, the harshest discipline is actually to not allow a doctor to write exemptions for 2-year period.
Well, actually,
is that the harshest that we can do?
No, so actually, it's a referral to the medical board.
If we're considering this to be a fraudulent level of activity, first of all, I don't even see the definition of fraudulent really in the bill. So, can we maybe discuss that as well? Because I'm interested to know, why does the bill have a definition of fraudulent medical exemption referring to what the CDC, ACIP, and AAP criteria would be denied under? Why is it that we're... Okay. And would that criteria change over time?
So just so you know, fraudulent is not in the bill any longer.
Right. I would point out, Assemblyman Nazarian, that the highest sanction would actually be a loss of your license, which would mean you can't practice anymore. And of course, loss of the license can only be performed by the Medical Board of California. So when you refer to the 2-year suspension, that was through the Department of Public Health. Correct. But that we've also included language for referral to the Medical Board. You've heard from the Medical Board that their biggest barrier is inability to get the information they need for their investigation. They can't even get off first base. And so this bill creates the opportunity for the Medical Board to get that information that they need to conduct their investigation. That investigation can lead eventually to various penalties, up to loss of the medical license, which would mean that that physician could no longer practice in the state of California. I'm not sure if there's other penalties you want to suggest, you can please do so, but I think that is the sanction that is available for physicians who are acting unprofessionally and unethically.
I'm sorry, doctor, but that's not very convincing.
That's the loss of a license?
I would have, well, no. How many licenses have been lost? I mean, you just explained that there was, what, 179?
Well, I think part of the issue is
Cases?
that we're not necessarily getting complaints on medical exemptions. And when we do, we don't have the ability to get the medical records in many of these cases because parents aren't signing off on releasing those medical records. So that is the obstacles that we're facing right now.
So we're doing another legislation to ensure exactly what now?
So basically, it'll allow us to get those medical records, and it'll also have CDPH
So can't we just do legislation that in a precise way allows that, authorizes you and gives you the capability of doing the things, as opposed to creating this process that, have we talked about the cost of what this is potentially going to weigh in on the
this
state?
is not a fiscal committee, this is a policy committee.
Okay.
It has been through a fiscal committee in the Senate. So, and it is with us now, and this is a policy committee.
Absolutely true. But I can't help but to feel that, we're trying to set up a process whose cost we don't know, that's going to address a very small constituency versus trying to do something on a bigger picture. If Mr. Chair, you don't mind, I want to know from whoever from the opponents wants to answer, what entails the procedure or examination for a medical exemption based on family medical history or genetics testing that you believe will not be considered by the state under the CDC guidelines? If someone can answer that, I'd be interested to know.
And then I would like to ask the supporters for the same question.
Okay.
So the question is, what would be a medical exemption under family history that would not qualify under CDC guidelines? Mm-hmm. Is that the question? Mm-hmm. It's incredibly important to understand what those CDC guidelines are, and that the senator did answer that the only CDC family history guideline is if a mom or dad, a first-degree relative, has a severe immune deficiency, and that the children might have that. And it only exempts you from MMR or chickenpox vaccine. That's the only family history factor in all the guidelines that are in this bill. There's a small family history factor about seizures. If someone's had seizures, you can't get this one brand of vaccine, but you can get other brands that qualify. So that doesn't work. So there's only one family history factor. So you guys have to realize, for example, I'll see a family, the mom had a seizure after vaccines. Her first child had a seizure after vaccines, and she has a new baby, and she doesn't want to give that baby vaccines. And as her doctor, I would agree. That's a good family history reason not to vaccinate that child. Or maybe, do we delay them? Do we wait till years later? I don't know. Maybe it's a temporary exemption. Is there a baby? There's no single CDC guideline that would allow me to write that exemption under this new law. Did no family history involved whatsoever that would justify me writing an exemption for that family, because that is not in the CDC or the AAP or the ACIP guidelines. And I appreciate that the Assembly members have asked a lot about family history. You have to realize how narrow that is. This new amendment did not broaden that in any way except for the select few, as the lady's example. Right? So there's so many. I mean, I could list so many severe reactions I've seen moms or dads have, or their first kids have after vaccines, that I will use as legitimate family history to write an exemption for a new baby in that family. That would all go away under this new bill. Those would all be disqualified. I think that's important for you guys to understand that.
Dr. Pan, again, I very much appreciate your tenacity, and you are going to respond to every point. And I think the reality is that this is not a black and white issue, and science changes every day.
Please.
You know that better than I do, even. You live and breathe and work this. So I'm not going to say more on that. It just, I feel that this is overreaching. If the intent of this was to go after doctors who are erroneously offering exemptions, I think there's a better way of doing it than creating this situation that will focus so much money on such a small area. And I really do wish you would consider making further changes to this, because I would very much want to support it. But as it stands now, I can't support this. So thank you very much.